Good evening and welcome to tonight's webinar. My name is Russell Burgum. I am a non-surgical interventional orthopedic physician practicing in what we call interventional orthobiologics, which I'll discuss briefly. I work with Regenexx at the Regenexx Des Moines Clinic, and welcome to tonight's presentation on reduce pain and avoid surgery using non-surgical treatments for orthopedic conditions. Briefly, I'd like to just go over just what is interventional orthobiologics. Interventional refers to doing an intervention on a person's body. It's a non-surgical intervention using high-resolution guidance technologies such as high-resolution ultrasound or real-time X-ray called fluoroscopy to guide injections into damaged or degrading tissues in the body for orthopedic injuries or conditions. So on the screen here we have a couple pictures that show on the left an ultrasound procedure room with ultrasound images up on the screen and the ultrasound machine on the right, and on the right fluoroscopy procedure room, which is the real-time X-ray showing some fluoroscopic procedures. I mentioned before I'm with Regenexx in Des Moines, and Regenexx prides itself as the place where orthopedic stem cell injections were invented. There are roughly 90 Regenexx affiliate clinics throughout the country. And the first one started with Dr. Centeno and Dr. Schultz in Broomfield, Broomfield, Colorado, which is just outside of Denver. And they were the first clinic to begin treating orthopedic conditions with stem cell injections. And with great insight, they began a patient's outcome registry, meaning all the way back to 2005, all Regenexx procedures have been, we track how well they work and how long they work and what procedure works in what joints. And as a result, with tracking these procedures since 2005, we have the world's largest orthopedic outcomes database. So this, I mentioned, interventional orthobiologics refers to using injectates, meaning things that we can inject into the body to facilitate healing of bone, tendon, ligament, cartilage, with very precise location of these injections, with using image guidance, and using tools that facilitate percutaneous tissue manipulation, meaning going through the skin without making an incision to address degenerating or damaged tissues. So there are a lot of people who do injections, but may not be considered interventional orthobiologics. So family medicine clinics, the orthopedic surgery clinics, sports medicine clinics can do injections, and the most common would be just simple injections without the use of any type of guidance, where the physician or oftentimes the nurse practitioner or physician's assistant palpates where the joint is and does an unguided simple injection just into the joint itself, not addressing all the supporting structures outside of the joint. And that constitutes about 95% of the US physicians. Now, about 4% will use guidance like ultrasound or fluoroscopy to guide that needle placement. But only about 1% of US physicians would be considered interventional orthobiologics. Orthobiologics refers to the use of biologic products to treat orthopedic conditions. So the biologic products would mean the patient's own cells, be it platelets from their blood or cells from the bone marrow, or even healing cells from fat tissue, which can include stem cells. So in interventional orthobiologics, if I'm treating a joint, let's say a knee joint, I often hear from other patients, gee, when I had the injection done at the other clinic, they just did one injection into the joint, whereas you poked me in 15 different places. And the reason for that is we we just can't treat the if we're treating an arthritic joint, that's where the cartilage is wearing down on the surface of the bones in the joint. That's part of the problem, but a large part of the problem is the fact that a given joint may be unstable because the supporting structures outside of the joint, such as the ligaments and tendons and the layers of connective tissue called fascia, if those are weak or stretched or unstable, the joint is unstable. So interventional orthobiologic physicians like myself will treat the joint, the tendons, the ligaments. In this case, this is showing a hip with all the structures around it. Up above the knee, where we have numerous tendons and ligaments and supporting structures. So we treat the whole unit to make the whole functional unit healthy. In the shoulder, there's two different joints. There's numerous rotator cuff tendons and glenohumeral or joint ligaments and cartilage. So I'm going a little too fast here. So it's very different than you're just doing a simple little injection. So, and there are other clinics that will say, "Oh, we do stem cell procedures," uh, and a Regenexx clinic such as ours is very different. One, all Regenexx clinics are use just physicians, not advanced practitioners to do procedures. We're very highly trained physicians that have subspecialty certification and board certification. All injections are used with guidance, such as fluoroscopy or ultrasound or both. There are many procedures that I'll do alternate back and forth. And your cells are processed in our own clean room facility and not just using a simple bedside centrifuge to get your, let's say, your platelet-rich plasma. And this is backed by a multi-million-dollar lab and clinical research facility at the main Centennial Schultz Clinic in Colorado, where they also have a fellowship program where they'll once a year they'll take on a physician to train for an entire year. And I did not go through the fellowship program, but there are a small number of fellows around the country. And I'll have to update my slide because there's more than 60 sites. There's probably closer to 90 sites worldwide now. And the big thing is we have the world's largest outcomes registry. So when a patient has a procedure done, so imagine if you had an injection, let's say a steroid injection at another clinic, or maybe a hyaluronic acid, a lubricant injection at another clinic. If that were done, if you had any kind of injection done at our clinic, before you even had the injection, we'd ask you to fill out a survey that takes about 5 minutes, that asks questions about what is your pain level, what's your function level, what sorts of things can you do or can't you do, how does this affect your life, etc. Now, after the procedure, you'll get similar surveys at 1 month, 3 months, 6 months, 12 months, 18 months. And when you get to 2 years, you start getting the similar surveys once a year for up to 20 years, as long as you keep returning them. And so as a result, we can determine what different procedures, whether they're platelet-based procedures or bone marrow stem cell procedures, what procedures are appropriate for different joints in your body, as well as different degrees of breakdown in your joints. For example, if you have mild arthritis in your knees, you might be a great candidate for platelet-only, platelet-rich plasma procedures. Whereas if your arthritis is becoming more advanced, the platelets might not give as long relief, and that's when we start looking at doing a bone marrow extract stem cell type procedure. So that registry gives us lots of information, lots of guidance as to what procedures should we recommend for you as a patient. And there are some oftentimes that based on the registry, I'll say, you are a very poor candidate for the procedure, even with our most high-tech procedure, because our outcomes database shows that patients in your situation might not get lasting relief. So in your case, I'd recommend you, for example, have a hip replacement if you have severe arthritis. Whereas our outcomes database would show for patients with severe knee arthritis, you're still a great candidate, provided we do the bone marrow stem cell procedure. So this outcomes registry is very important. So we perform precise image guided MSC, BMAC, and platelet procedures. So MSC means mesenchymal stem cell, and BMAC is bone marrow aspirate concentration. So that's where we take the bone marrow out of the back of your pelvis and separate out the different layers in the bone marrow and take just the small, very potent healing layers to inject. And we can treat things like neck pain causing headaches, upper back pain, shoulder issues such as rotator cuff tears, arthritis, labrum tears, wrist, thumb, hand, finger problems, low back pain, hip arthritis, knee arthritis, knee ligament tears, knee ACL tears, meniscus tears, ankle arthritis, foot arthritis, foot tendon injuries, ligament injuries. So I mentioned that we're tracking outcomes in our database. So this shows kind of the order of what our most commonly treated areas are, and the numbers underneath each one tells you how many procedure cases we are currently tracking in the Regenexx network outcome database. So these numbers are as of a few days ago. So there's almost 20,000 knee procedures and almost 15,000 low back procedures. And as I go down, you can see which ones are less common, but still, even with one of our less commonly seen conditions, elbow problems, where you have almost 1,600 cases that we're tracking. Now, for different clinics may have different areas that they see more of. Like, for example, in my practice, I see a lot of knee and a lot of shoulder and hip and quite a bit of elbow and a fair amount of hand and foot and ankle conditions. Just today, I think all my procedures were foot, ankle, hand, and knee. So it varies from clinic to clinic, but you can see by these numbers that we have a large outcomes database. So here are some more examples of what's considered interventional orthobiologics. So this is a fluoroscopy suite picture showing treatment of knee arthritis. And in particular, we're treating breakdown of the cartilage underneath the kneecap. So on the left here, that's a fluoroscopic suite showing full surgical draping and prep and surgical gowns and sterile covers over the fluoroscopy machine here. On the right, lower right, that's an MRI image showing a kneecap called the patella right here, and the femur, the thigh bone. So this is showing breakdown. This bright white in the kneecap represents a bone marrow lesion or bone marrow edema, and that's a sign that the bone and marrow inside that kneecap is breaking down and it's degrading, and it actually, the cartilage on the surface of the bone where I'm outlining with a pointer, it gets its nutrition through the bone. So patients can have conditions where the bone is breaking down on the inside, and that can contribute to rapidly advancing arthritis. So when we see this, when we see this type of condition, not only do we treat the surface of the joint where the cartilage is, which if you look at in the above picture, this little skinny line is a needle with contrast dye showing that the needle is in the joint surface here. But also we have a procedure called intraosseous, meaning into the bone augmentation, where we can actually guide a bone trocar, which is like a thick needle that you can attach a syringe on the back, the end of it. You can guide a bone trocar into the bone itself to help it heal from the inside out. So that's called bone augmentation. Other things we often do, we can treat ACL tears. Inject the anterior cruciate ligament, the main stabilizer inside the knee, has two different bands, and we can address those with fluoroscopic guided injections into those two bands. And that's what these dark kind of splotches are, is contrast dye, showing it's the needle is in the ACL band. Also, similarly, on the right here, we've got fluoroscopic images showing treating a labrum tear. SLA means superior labrum anterior. And this is a shoulder joint. And this dark line here shows contrast injected into the joint. And then the needle is directed a little higher into the labrum. So why will these procedures replace elective orthopedic surgery? And just as a side note, with our large outcomes database, we have been able to have that analyzed to look at what's called quality scores, quality added life year scores, which is a number that looks at not only how does this procedure extend your life, but what is the quality of your life? You can have a, let's say if you had a certain surgery, let's say a heart surgery, if it keeps you alive, but you can't do anything, that would be, you may live a long time, but your quality of life would be very poor. So that would have a low quality score. And that would be a type of surgery that heart surgeons would say we don't recommend. You always want to do procedures that not only increase your lifespan, but make your life a higher quality. A lot of times orthopedic surgeries or hip replacements can extend the joint, but you may not be very functional. You may not be able to kneel or squat, etc. So with this large outcomes database, Regenexx has been able to approach companies across the country who have self-funded insurance. They have their own health insurance and they fund their own insurance plan for their employees. They've been able to approach these companies and say, look, we can help your patients avoid elective orthopedic surgery at a much lower cost. And as a result, these companies have signed up to provide regenerative medicine treatments to their employees only through Regenexx clinics. Through their insurance plan. So there are currently over 2,000 companies across the country that take part in what's called the Regenexx corporate program to provide our services to their employees with the sole purpose of avoiding elective surgeries. And so we've been able to show this is less invasive, that patients recover quicker. And after patients have a procedure done in our clinic, you get up and walk, you walk off the table, you get up off the table and walk. You can walk and do your daily activities immediately afterwards. And you preserve your own body. You don't have artificial components in your body, and you keep your biomechanics intact. So as we talk about the different things that we inject, I want to address what are growth factors versus stem cells versus cytokines, because some of these terms may come up if you're looking online or looking at different procedures that are available at different regenerative medicine type clinics. So growth factors, we think of it like the espresso shots at a local, that the special shots, concentrated healing factors that stimulate local repair to get kickstart your cells into healing. And they're natural chemical messengers that tell cells to do things like clean up inflammatory chemicals in your knee, or help stop inflammatory products in your joint that may destroy cartilage. And A2M is a cytokine that does that. A2M is found in platelet-rich plasma, which I'll talk about shortly. Stem cells are more like the general contractors on the building site inside your joint or inside your muscle or tendon. The stem cells will signal other cells in the area to do different healing processes or different healing chores, and they direct the repair of the tissue damage in the area, and then at the end can turn into tissue themselves. So a large portion of the procedures that we do, more than half, are involve platelet-rich plasma, or PRP. And so PRP is really, so let me back up. Plasma is a component of your blood. So our blood has red cells and white cells, and about 40% of the volume of your blood is this yellow kind of clear fluid called plasma. And in the plasma, that's where the platelets reside, and there are many other components and growth factors and proteins in the plasma. But what platelet-rich plasma is a process where we draw your blood and draw many vials of blood, depending on how many areas of your body that need to be treated and how many platelets we want to compact into a small volume, or another term for that would be the concentration of your platelets. How concentrated are the platelets you need? These all determine how much blood that we need to draw. So we draw your blood through the vein and then separate out the red cells from the white cells and leave the plasma behind with a centrifuge. Now in this, and then we take all that plasma, which has platelets intermixed throughout all the plasma. So we draw out all the plasma from all the vials, and you get a large collection of plasma with platelets mixed throughout all of that. Now we take this large volume of plasma and extract all of those platelets and reconstitute that large volume of platelets into a very small volume of plasma. So you've taken a large volume of plasma with platelets intermixed all throughout and compacted it into a very small volume of a very potent platelet-rich plasma. So you have lots of platelets in the plasma, so that's called PRP. And there are clinics all around the country who say, yep, we do PRP, we do PRP injections. And the difference with a Regenexx clinic like ours is that I can concentrate your platelets to the dosage that you need. And so I mentioned concentrate and dosage together. So the concentration is analogous to the dosage of a medicine, for example. So we know there's well-published research that shows the older the patient is, the higher the concentration of PRP you need, meaning we need to start with a lot more blood and get lots more platelets and put them in a smaller volume, depending on your age. Also, the more advanced your condition is, the more advanced the arthritis is, or the ligament damage or tendon damage, the more platelets you need to put in that area. So that becomes an issue because 95% of the other clinics around the world, or around the country at least, are limited as to how concentrated they can make their PRP, because they're limited by the PRP kits that they buy, the processing kits that they buy from a medical device manufacturer. And those kits can vary anywhere from concentrating your platelets to maybe 1.5 to 2 times the normal concentration found in your blood, to maybe 5 or 6 times your concentration. Well, platelet-rich plasma is defined as being at least 2 times your normal concentration. And that becomes an issue if you're over the age of 30. The studies have shown that under the age of 30, you benefit by concentrating that platelet-rich plasma to levels of, let's say, 5 to 6 times your normal concentration in your blood. Well, that's about the highest concentration that these bedside kits that are used at other clinics, the really, really good kits, can generate. However, most of our patients are over the age of 30, and as you get into the 40s or 50s, you need a concentration somewhere in the 12 to 18 times your normal blood concentration. And over age 60, really, you're looking at 20 times your blood concentration. And we can do that in our own custom state-of-the-art lab. And every procedure that we do, I pick what concentration that the patient needs for their platelet-rich plasma. So another thing that we use is growth factor-enriched serum, or platelet lysate. So let me back up. So platelet-rich plasma, when I inject platelet-rich plasma into a joint or into a ligament or a tendon, the platelets begin releasing their numerous growth factors when they come into contact with connective tissue, and they'll continue to release those growth factors over the course of 7 to 14 days. So that's kind of like an extended release medicine. Now, we have the ability to break the cell walls of the platelets in the lab and filter out the cell walls and just leave all of the growth factors behind, and that's called platelet lysate. And that is like an immediate release medication, so to speak. Platelet lysate is also what we use to treat irritated nerves, such as carpal tunnel syndrome in your wrist, or cubital tunnel syndrome in the elbow, or impinged nerves in your neck or your low back. So that's called platelet lysate. And in a Regenexx clinic, it's called platelet lysate modified, because we do an additional step to make it more potent. So I mentioned that platelets release numerous growth factors. This slide shows all the different growth factors that the platelets release. So they release these growth factors that cells in the area will pick up and become more activated. For example, platelets will stimulate stem cells in the area to become more active. They also will stimulate those stem cells, or MSCs, to differentiate, meaning for them to change into their end product, such as, because stem cells can change into cartilage or tendon or bone or muscle. So platelet-rich plasma stimulates those activities. They also can stimulate new blood vessel formation, cartilage regeneration. The most obvious one is starting the clotting cascade. When you get a cut in your skin, platelets in your blood become activated. They help stop the bleeding, and then they start new skin growth. So there's numerous growth factors that platelets release. And one of the things that we take advantage of is that they stimulate stem cells to be more active. Now, stem cells, or MSCs, mesenchymal stem cells, are very potent activators to promote your body's own innate healing. And in our clinic, we get them pretty much currently we get them all from your bone marrow, from the back side of your pelvis, and that's called BMA, or bone marrow aspirate. And they can help repair tissues, and we can also concentrate those at a much higher degree than other clinics can, using a bedside centrifuge. And we do that in our custom lab right down the hall from our procedure room. So in general, people are always afraid, or they hear stories about, boy, I hear bone marrow procedures are painful, or they may have heard of a friend or family member who's had a bone marrow biopsy for cancer, or for some hematologic disorder. And I can honestly say 95% of our patients hardly feel anything at all when they have a bone marrow aspirate procedure. They're always surprised at how little they felt. And every time I do it, I'll ask a patient, tell me what you're feeling as I'm drawing the bone marrow out. And 95% of the patients will say it's just a weird sensation. So this slide shows the tools that are used when we draw bone marrow out. This is called a bone trocar here in the center. It has a central rod that goes in the middle and has a very sharp tip at the end, and that's what we use to bore into the bone. Once we get in, we draw that out, and now the outside part here is just left, and it's got it's hollow on the inside, and you can attach a syringe to it and slowly draw the bone marrow out, which is looks like blood. It's a lot of it is blood. It's just a little thicker than blood. And I do it by hand. You can use a power drill. I like to just use my own force so I can really feel what I'm doing. Very rarely I'll use the bone marrow drill, but we use IV sedation to make you're awake, but you're a little drowsy, and we can also put pain medicines through the IV. It's a completely sterile surgical type procedure. I mentioned the IV conscious sedation that we do, and it's very well tolerated. So that is what we do when we need to get MSCs for more advanced arthritis. So this shows the position. We come in through the backside along what's called the iliac crest, and the very back of the iliac crest, if you look way over on the right here, it gets thicker. That's called the posterior superior iliac spine. And so I come in kind of from the side. This shows how you've got thick bone on the edge, on the outer surface of your bone, and inside is kind of a spongy honeycomb structure, and that's where we get the bone marrow from. So we do that because there's numerous cell lines that have healing capabilities. We use a very high dose bone marrow concentrate containing live cells. We count the total number of nucleated cells, which a small portion are actually stem cells. The others are these different cells, but we count the number of cells on every procedure, and that also is tracked in the patient outcomes database. So a lot of people ask, well, why don't these cells just go to the area of injury anyway? Because they're already in our body. The platelets are flowing through our blood. And MSCs are actually, the stem cells they're resident throughout your body. We have stem cells in our muscles and organs and tissues, and they're waiting to be activated. Platelets, I mentioned earlier, they become activated when they come into contact with connective tissue, specifically collagen. So if you get a cut in your skin, there's collagen in your skin. We have a good blood supply in our skin. You bleed right away, and the platelets become activated. So that works great in places where you've got a good blood supply. However, tendons and ligaments and cartilage don't have a vigorous blood supply like your skin. So that's why we take a large volume of platelets, concentrate it into a very small volume, and precisely inject it into the tissues that's needed, and that's ligaments, tendons, and joints. We also can do injections into muscles that are fading away or weakening or becoming getting atrophy. We can inject platelet-rich plasma, or we can take what's left from the plasma when we've extracted the platelets. What's left is called platelet-poor plasma, and that has numerous nutrients and growth factors in it as well. And muscles and connective tissue called fascia really respond well to platelet-poor plasma. So things we treat, I mentioned earlier, knee, we can help patients avoid joint replacement, and we can treat rotator cuff tears and the anterior cruciate ligament tears. We're able to treat patients with severe arthritis, and we know that because we track it in our outcome database. Even patients with severe knee arthritis are considered good candidates for a bone marrow stem cell type procedure. We can treat mild arthritis to prevent it from getting worse, and primarily we use platelet-rich plasma for that. And meniscus tears, we treat routinely. Smaller tears we'll treat with platelet-rich plasma. Some of the more bigger tears we'll generally try to use the bone marrow stem cell concentrate. So we currently have 19,553 patients being tracked for knee procedures as of 2 days ago. Patients generally will rate their improvement at 38% by 1 month after the procedure, 51% by 3 months, and 61% by 5 years. And all of our outcomes data is available on the Regenexx main website. If you look at regenexx.com, you can look under areas treated, and you can pull up curves of pain reduction curves, percent improvement, functional rating improvements for any of the different regions. So that's where this comes from. So then I mentioned functional rating. So if we looked at what's your initial rating, most patients who have a procedure would rate their current knee function at 56%, and by 1 month that increases to 66%, 73% by a year, and 76% by many years beyond that. So I mentioned the interosseous bone augmentation. This is an MRI image showing bone marrow swelling or bone marrow edema, and and this is an area where it's actually breaking down under the surface of the bone. This is where the cartilage layer is, and so if patients with bone marrow edema, there's great studies going back at least 10 years by. Most of them were done by an orthopedic surgeon in France, Dr. Philippe Hunergo, who did the groundworking research study showing that you can do the interosseous bone augmentation procedure by injecting either platelet-rich plasma into the bone, into the area where it's swollen, or bone marrow extract stem cells into that area and resolve that bone marrow edema. So that's important because the cartilage on the surface of the bone gets its nutrition through the bone, as well as from some of the synovial fluid, the fluid in the joint. But you can have patients who have only mild arthritis but may have developed a bone marrow lesion in their knee or their hip, and that inhibits nutrition from getting to the surface of the bone, which means it's a precursor to rapidly progressing arthritis. And you can actually change the course by doing a bone augmentation injection in that area to get it to heal from the inside out. In Regenexx clinics for almost 2 years now, are for patients who have moderately severe to severe knee arthritis, regardless of whether they have bone marrow lesions in that area or not. But if they have severe arthritis, let's say on the groin side, on the inside of your knee, our standard of care is to treat the surface of the cartilage with a bone marrow stem cell extract and inject into the bone, doing the interosseous bone augmentation, and we are getting excellent results. And I'm always surprised at how little pain patients feel afterwards. In general, patients will say, yeah, it was pretty sore that night and the next day, and they had to use the pain medication. I'd give a prescription for pain medication for like a 2 or 3 day course. But 95% of the patients will say, I only needed 1 or 2 pain medications that night and the day after, and I haven't needed any since then. So these are some pictures showing what are those tools. So we use a smaller type of bone trocar than what we use to draw it out of the back of your pelvis. We use a smaller type of needle, like on the bottom right here, to actually go into the bone. So this shows it going into the femur on a knee, and this is on the tibia, the shin bone. So that's what IO, interosseous bone augmentation is. So I mentioned we can treat ACL joints, ACL tears, and the types that we can treat are partial tears or full thickness tears that are still close, the ends are still close to each other. However, if you have a full thickness tear where it's completely ruptured and retracted, that is not something that we would be able to treat. And these are the same pictures I showed before of the different bands of the ACL that we treat. So we're also able to treat patients with moderate to severe shoulder arthritis and rotator cuff tears and labrum tears. So I just wanted to address some of the hype around stem cells, because if you do a search online on stem cell treatments, you'll get books and videos and different clinics promoting being able to heal anything from dementia to erectile dysfunction to knee arthritis there's all sorts of hype. There's people talking about how they got stem cells put in through the IV and it treated their whole body, and so there's a lot of hype out there, and in general, whenever there's a new technology, there's kind of 3 kind of phases of adopting this new procedure or new technology. And the first is, gosh, this is awesome. This is great. It helps everybody. It's like magic. And then as people become more mature in their knowledge of the technology, they'll realize, oh, this is great. It helps almost everybody, but not all things. And then as you're into the a more mature process would be, let's figure out who is a good candidate. And that's one thing that Regenexx clinics, we pride ourselves in, is every patient we assess, what is your candidacy rating? Are you a good candidate? Are you a fair candidate? Meaning, well, you know, you got a good, maybe a 2/3 chance of getting many years of relief, or are you a poor candidate where we think, boy, you've got maybe a 1 in 3 chance of getting maybe 9 to 12 months of relief. So we come up with candidacy ratings on everyone, mainly as a basis using the outcomes database, but also I look at what type of healing environment does your body have, because all of these procedures are stimulating your own innate healing. So what makes someone a good healing environment? Well, if you're physically active, you avoid cigarettes and excessive alcohol, avoid fast food or highly processed foods, eat a healthy diet with lots of vegetables, lots of fruits, lots of healthy oils, such as omega-3 oils, olive oil, healthy nuts, different supplements. There's great research showing that they can promote longevity, decrease chronic inflammation. So we go over your diet and your lifestyle, and that in detail, and give recommendations on how can you increase your healing potential before you do a procedure. And based on that, we may either tweak up or maybe tweak down your candidacy rating. So we always look at who's a good candidate. So one of the biggest abuses that I see in this whole stem cell hype is clinics promoting amniotic or placenta tissue or cord tissue stem cell procedures. And they'll say it's FDA approved stem cell injection using placenta tissue. So the whole issue of being FDA approved needs to be addressed, because the FDA is the Food and Drug Administration. So FDA regulates drugs. They also regulate which medical devices are safe to be used. The FDA does not regulate procedures. For example, having your appendix taken out is not an FDA approved procedure. FDA doesn't approve medical procedures. The FDA doesn't approve a knee injection, a knee steroid injection. The FDA would approve the steroid that is being injected, because that is a drug. So amniotic tissues are considered dead product tissues that are regulated by the FDA. But the thing I want to address is the biggest abuse is when people are calling these stem cell injections, because if you're taking someone else's tissue, placenta tissue or cord tissue or amniotic tissue, and injecting it into another person, it has to be sterilized. So all these amniotic tissues have been sterilized there, and it's been studied at least 3 major institutions, as well as the Regenexx research labs, showing that there are no live stem cells in any of these amniotic tissues. There are some growth factors in these tissues. However, even those levels of growth factors are lower than if you were to just draw a patient's own blood and inject just whole blood into the area. The whole blood would have more growth factors than these products. But yeah, it's dead tissue. There's no viable cells. And so they're regulated as dead tissue products. So if you see clinics advertising we're doing amniotic tissue or placenta stem cell injections, I would look elsewhere. All right, so now we've got time for questions. If people have any questions, we have some time to answer questions. And I also want to put up my contact information. We're in Des Moines, and listed there's our website and the telephone number. And if you go to the website also has links to different educational resources. And if you're thinking, is this something that I could benefit from? Would I be a candidate for a procedure? There is an actual form where you can put in your information. There might be a few questions to answer, but in general, it's getting your information in. And when you submit that form, our education team will contact you and go over what sorts of issues are you having, um, what sorts of treatments have you had so far, and they can do a fairly thorough preliminary screening to see should we get you in to do an evaluation and see if you're a candidate for a treatment. And that brings up a point that I did not mention earlier, and that is when you come in for an evaluation, it's not like a 15-minute visit to the orthopedic clinic that you may have had before. When I do an evaluation, you're spending an hour, maybe an hour, 15 minutes with me. And then after that, there you have 15 to 30 minutes with our education team and our patient care coordinator. So it is a very, very thorough evaluation. For example, if you have a knee issue, I'm not just going to look at your knee, or like in other clinics, you may just look at your knee x-ray and do a very cursory knee exam. Well, we look at your whole kinetic chain from your foot up to your low back, including your hips, your knees, your ankles, and to look and see what are some of the other contributing factors. So if at the regenexxdemoines.com site, you will see where there's links to get in for an evaluation. So the question is, are your procedures and x-rays covered by insurances? So our evaluation, our office evaluation, and the x-rays and ultrasound evaluations are covered under insurance. The injection procedures are covered under the Regenexx corporate program if your company is one of the 2,000 or more corporations that pay for this through their self-funded insurance program. But in general, health insurance currently doesn't cover regenerative medicine treatments. There are some insurance plans that do, like TRICARE, which is for military families. I know they'll cover platelet-rich plasma for tennis elbow on the elbow, and I think knee arthritis. But currently, general insurance isn't covering regenerative medicine treatments. All right, we'll go back to the contact information. All right, well, if there are no other questions, we'll end our talk tonight. Again, you can always reach out through the website or through the telephone number and get a hold of us. And I hope to see you soon. So enjoy the nice spring weather. And at any time, if you have questions, just give us a call and we can get you in for an evaluation. So thank you for your time and have a good night.